Here are my people for my informative speech. Wave 1, 2, 3, 4, 5. My topic for today is food allergies. I'm here to inform you about food allergies and how to prevent potentially life-threatening allergic reactions. According to the Food Allergy Research and Education, 1 in every 13 children are at risk of severe food allergy reactions. This is a startling high number of children who will experience an allergic reaction caused simply by doing what every living creature needs to do: eat. The Asthma and Allergy Foundation states that nearly 1 in every 50 Americans are at risk for a severe, life-threatening allergic reaction to food. When my youngest child was born, I knew that there was something different about her than my other children. She simply could not eat and would just get sicker and sicker. She spent the first 3 years of her life sick and having many health issues and health scares. My daughter was eventually diagnosed with food allergies. So I've been almost a 5-year battle to help my child be healthy. I've talked to many doctors and learned the stark realities about food allergies and the potential risks of them. I'm not a doctor, but I am a parent who lives every day with a child who has food allergies. All of us know or will know someone that is impacted by food allergies. The statistics tell us so. 1 in every 13 children, 1 in every 50 Americans will be affected by food allergies having a severe reaction. Anyone around these people need to understand what food allergies are and how to become educated by that and how to prevent them. We live in a culture that's surrounded by food. We go to parties and eat food. We go to family reunions and eat food. We go to all kinds of different functions and eat food. But these foods that we have to eat could be potentially harmful to people that we love. And as I stated before, I am not a doctor, but a parent who lives every day with a child who has food allergies. My goal in this speech is to help you, the audience, understand food allergies better and help prevent somebody from getting sick because of what they eat. Let's first understand what food allergies are. To keep those people around us safe, we have to understand what food allergies are. Food allergies are an immune system response that can react to even the tiniest bit of food, a crumb, a speck. This means the body sees the food as an unwanted invader into the body, like bacteria or viruses, and not like nutrition like other food would be seen as. The immune system's job is to keep harmful things out of our body, like the bacteria and viruses. But with food allergies, the system only recognizes the food as a harmful invader. The immune system goes into overdrive then, causing the many problems of a severe allergic reaction. This is a sudden reaction that comes on very shortly when food is eaten by a person who is allergic to it. Some people have such a severe allergy to certain foods that any kind of contact can be potentially dangerous to them. Even touching something that had the food on it, like a plate that had a donut on it, and somebody who has a wheat allergy simply picks up that plate to put it in the sink, could be potentially dangerous for that person. This can mean food that's simply touched, breathed in, had a food sat beside it, can all be dangerous to them. A reaction, even if a reaction is a mild one, that doesn't mean that every reaction of the person with food allergies is going to be mild. On the contrary, every time a person who's allergic to a food is exposed to it, the likelihood of them having a severe reaction actually increases. We cannot train our bodies not to be allergic to the foods. It's impossible. Next, let's talk about the symptoms of these reactions. It's very important to be educated about the symptoms of food allergy reactions because some of them can be very, very mild, but then hit really quick, and some of them are just kind of different. Anaphylaxis is the most severe of allergic reactions. A person experiencing anaphylaxis will have a severe swelling of their airway. It can mean their throat, their lips, or their tongue, impeding breathing. And it also includes a decrease in the blood pressure. The heart rate starts to mess up and the blood pressure is decreased. According to the Food Allergy Research and Education, anaphylaxis can feel like a scratchy, burning sensation in the throat. And also can feel like a person's lips are tingling or numb, or that they have a frog in their throat. These statements are oftentimes by children who cannot describe what's going on with their body. So they say they have a frog in their throat, or their throat is scratchy, or their lips are numb. These are things that when you have a child who is food allergic, you need to be aware of. Other symptoms of anaphylaxis are turning blue because of the airway constricting, a shortness of breath, wheezing, trouble swallowing, chest pain, a loss of consciousness. If any of these symptoms appear, it is very important to dial 911 and get immediate medical treatment. These will not go away. They will only get more severe and become life-threatening. If untreated, anaphylaxis can be life-threatening. Skin reactions are another symptom of a food allergy. Hives is a red and swollen, itchy places that usually cover a large amount of the body. They raise up and they're extremely itchy and swollen. Eczema is also a sign of food allergies. And eczema is a persistent, dry, itchy rash, usually over patches of the body. Also, digestive problems can be a sign of food allergies. Nausea, vomiting, diarrhea, and stomach pain are some symptoms of digestive problems with food allergies. Now let's look at some treatments for food allergies. Treatments for food allergies. Epinephrine. This is a medication that can stop a reaction when it started. It is the only medication that can stop a reaction when it started. It is quick acting. This is an EpiPen Junior. And epinephrine is in this EpiPen. When a person has a severe food allergy, they must carry epinephrine. And usually it's in a form of a pen, an auto-injector. Okay? Wherever they go. This medication is used for severe food allergies that can lead to anaphylaxis. This is the only thing that can sufficiently treat somebody who is experiencing anaphylaxis is the EpiPen. Once the EpiPen is administered, you still have to call 911 or go immediately to the emergency room, even if the symptoms have gone away, because you still need treatment and you need to be checked out by a doctor. This medication helps reduce swelling of the airways and helps the heartbeat correctly because it contains adrenaline. And the adrenaline will actually help regulate your heartbeat and decrease that swelling. An EpiPen is very easy to use, and anybody who has somebody that they love or in their family that has a severe allergy that carries an EpiPen should be aware of how to use one of these. It can be potentially life-saving. Other medications used to treat allergic reactions are steroids. Steroids do help reduce swelling during a reaction, but it is not fast-acting like an EpiPen is. Asthma inhalers, like an emergency inhaler, is also used to treat allergic reactions. An emergency inhaler uses steroids that are inhaled directly into the lungs to help reduce the swelling that can come with an allergic reaction. Antihistamines are also useful for mild reactions. You can use antihistamines. We know some Benadryl. We can use Benadryl for mild reactions, but we do not need to use Benadryl unless directed by a doctor. And if you do have to use even the mildest of antihistamines, you need to contact your doctor. Because like I said, a mild allergy does not guarantee that you're always going to have a mild allergy. And your doctor needs to be aware of every time you have some kind of reaction. The best treatment of all for food allergies is prevention. You have to not eat the food that causes the allergy. Like I said before, you cannot train your body to be not allergic to that food. On the contrary, you can actually have worse reactions. Someone with food allergies cannot even have one bite of food that they are allergic to. They cannot have food that comes in contact with the food that they are allergic to. Prevention is always the best treatment. Now we know the symptoms of food allergies, and now let's learn about the most common causes of food allergies. The most common food allergies are peanuts, tree nuts, milk and eggs, wheat and soy, fish and shellfish. These are not the only allergies, but they are the most common. Let's take a minute and think. How much food can contain milk, eggs, soy, peanuts, tree nuts, fish, shellfish? It's mind-boggling when you start to think about it. And a person can be allergic to any kind of food. These are not just the only things you can be allergic to. They are just the most common ones that people tend to have. My daughter actually is allergic to blueberries. It's not a common allergy, but she is allergic to them. Now we're going to learn about general safety practices. It is not just as simple as not eating the food you're allergic to prevent a reaction. Everybody needs to understand, whoever's around the person who has food allergies, family, friends, co-workers, whoever it may be, have to know about general safety habits for somebody who has food allergies. Make sure the person who is handling any kind of food for a person who has food allergies thoroughly wash their hands. It doesn't matter if they're simply carrying a plate to the table. They need to thoroughly wash their hands because a crumb can hurt. Make sure all dishes, utensils, cooking surfaces are all thoroughly clean and does not contain anything that can be potentially harmful for a person with food allergies. Read all food labels and other products like shampoo, body washes, makeup. You'll be surprised at how many things contain these common allergies. Watch out for words like may contain the food allergy. Watch out for words like processed in the same facility as the food allergy. These foods, even if the food that you bought is safe, if they have these words on the back of the labeling, they can be potentially unsafe for a person with food allergies because they may have come in contact with that allergen. Don't be afraid to ask questions. Food allergies is a serious medical condition and should be treated as such. Be open with your doctor. Become prepared with a list of questions and concerns. No question is a dumb question. Always ask before you eat or allow your child to eat if the food in question if you ever have a question about the food. It's better safe than sorry. It's better to say, does this contain wheat? Does this contain dairy? Does this contain blueberries? Because asking a question is a lot easier than having someone have an allergic reaction. With children, you need to empower them to take control of their condition. Teach your child about their allergies and their medication. Teach them how to use their EpiPen. Teach them what an EpiPen is. Teach them how to explain this to people around them. Teach them how to use their asthma inhalers. Let them take control of their condition, not their condition take control of them. Teach them to cook foods that are safe for them. Buy special cookbooks. Watch special shows. Teach them about the food they can eat. Celebrate and focus on what they can have, what they can do, instead of focusing on just what they can't have. Remember, the child is not their food allergy. They can do many things for their own treatment and care if given the education. Be educated and have a plan. Be sure that you have an emergency plan set up. Talk to your doctor and they'll help you with this emergency plan just in case you do have a reaction or you have a loved one that is having a reaction. Have phone numbers to your doctor. Have phone numbers to your pharmacist. Keep them with you. Have a plan. Be prepared. Teach every person around you or your loved one about food allergies and safe food handling procedures. Teach it, teach it, teach it, teach it, teach it. You take control of your allergies. Teach your family and friends about label reading. I can't stress this enough because once my child started having these food allergies and everything, we started realizing what she was having and everything. It was mind-boggling at what could potentially be harmful. Read those labels. Become familiar with terms. Wear a medical alert bracelet just in case you have a reaction out and about, or if your child has a reaction away from you. Have a bracelet that says, I'm allergic to nuts, I'm allergic to dairy, whatever. Just let people around you be aware. Because if you start having a food reaction or when you are alone, people might not know what you're allergic to or might not know how to treat you. But if they have a bracelet, you have a bracelet, they can at least know what could be going on if you are experiencing anaphylaxis out and about. Every person is affected by food allergies in different ways. They may have loved ones. They may themselves maybe have them. And every person has different treatments. They have different allergies. They have different reactions. My goal in this speech is to give you a brief overview of food allergies and some tips on how to keep the person you love safe. And I encourage you to take the information I have given you and go further. Take steps to become educated about food allergies and prevention, especially if you have a friend or family member that has food allergies. Like I said, I'm not a doctor. Talk to your doctor. There's lots of websites that can help you. Food allergies can be very serious and should be treated as such. I have 2 children with severe allergies. I have one that has food allergies, and I have one that actually has medication allergies. And I cannot stress enough that one bite does hurt. Come here.
Mommy.
I cannot stress enough that one bite can hurt. One bite can change their lives forever. I want to leave you with this statistic from the Food Allergy Research and Awareness Organization. Every 3 minutes, a person in the United States goes to the ER for a severe allergic reaction. That's far, far too many. And we all can take steps to reduce that number by becoming educated and aware. Thank you for your time.